Hello, today we're going to be doing an abdominal physical assessment. So the first thing that we want to start off when we're looking at the abdomen is to inspect. So we're taking a moment to look for any scarring, any discoloration, any abscesses, any signs of jaundice, any protrusions, masses, lesions, things of that nature. So everything was within normal findings, and his abdomen is flat. It's non-distended. This is a normal finding. So the next thing that we move forward is to listen, right? Because we don't want to cause any manipulation and hear any type of like false sounds or elicit any pain, because that can alter our results. So first thing we're going to start off is listening to bowel sounds. We're going to start clockwise, starting in the right lower quadrant. Okay, those are normal active, so this is a normal active bowel sounds heard. The next thing we're going to move forward is to listen to his aorta, his renal arteries, and then the iliac arteries. We're checking for any type of bruit, that turbulent blood flow. That would be an abnormal finding. So that's the aorta. Next, we're moving into our renal arteries. And then into our iliac arteries. You can also listen with the bell of the stethoscope. So that was with the diaphragm. This is going to be with the bell. The bell is very good at picking them up as well. Okay, no bruise felt, so that's good. That's a normal finding. Next, we can move into our percussion, which can do just a general percussion at this point. So we're checking first for the dullness. So we'll start on our right side. Okay, so we're checking from when it goes to resonance and into dullness. So we hear it's starting to become dull about this area right here. So right mid-clavicular line, probably about like the 7th rib or 7th intercostal space. Okay, and then next we're going to go onto our left side, and we're going to be percussing for the spleen. Okay, so about here is where we hear it change from a change into dullness. Okay, and then all throughout this area, we're really going to hear a lot of that tympanic sounds. And then really in this umbilical area, this is where we're going to hear some hyperresonance. Okay, good. So everything's within normal findings. We can also next try to percuss to find the general liver span. So first we start pretty high, and we are going to listen, we're going to percuss, and we're going to be seeing where it changes from resonant sounds into dull sounds. Okay, so it begins about here. So I would say it's about the right midclavicular line, the 7th intercostal space. So that's good. So that's basically a normal finding, and then we can also continue percussing to see where the tip of the liver ends. Okay, so it ends about here. So this is all normal findings. Nothing enlarged. This is good. We don't want to enlarge liver because that could be indicative of like cirrhosis or something, some type of malignancy. So this is good. This is a normal liver span. Percussion's all within normal. So the next thing we can also do too is we can just check the CVA, the coastal vertebral angle. So what we would do is we would have our patient roll over to their back, or expose their back, so roll over on your stomach, show your back. Okay, good. And then what we're checking is about the 7th intercostal space to 12th intercostal space. We're taking our hand, laying it flat on our right hand side, and we are going to percuss it here, and we're trying to see if we elicit any type of pain. Any pain felt?
No.
Okay, so that's good. That's a normal finding. If you were to experience any type of pain on either side, that would be indicative to say that there's something going on with the kidneys. The kidneys might be inflamed, they might be enlarged. And you can flip back around on your back and expose your stomach again, making you work. Thank you. And then next we can go into palpation, the last part of our physical examination of the abdomen. So we first always want to start off with like a light type of palpation. We're checking for any type of tenderness, any abdominal distension, discomfort. Okay. And then next, now that we've done a light, we can go into a deeper palpation. So let's start with the liver. Okay, good. The liver is normal. It is not enlarged. It's not inflamed. It's not eliciting any pain response. Next, we can go to the spleen. It's okay. You can put your arm down. Okay, good. Now, normally the spleen should not be felt. If you can feel the spleen, that means the spleen is enlarged, and that can be indicative of like an inflammatory process or some type of malignancy. So that's an abnormal finding if you can feel the spleen. Next, we can go into palpating the aorta. So this can be significant if you're seeing a pulsation through here. You can see that. That could be indicative of like maybe some type of aortic aneurysm. So what we're going to do is we're going to palpate for it. So this is a deep palpation for the aorta. Okay. Good. I don't feel any type of thrill. I don't see any type of like violent vibration coming from there, no pulsation, so that's good. That's a normal finding. Next, we can move into eliciting rebound tenderness. So we would go to our right lower quadrant and we would press down deeply. Our left lower quadrant, I apologize. And we would press down deeply and release. And we would check that if while on our left lower quadrant, while we're applying deep palpation, if that elicited a pain response in the opposite side in that right lower quadrant, that would be indicative of appendicitis. So again, we would just elicit a deep palpation on the left lower quadrant, release, and then if it caused pain on the opposite side, that would be rebound tenderness, and that would be a positive sign for appendicitis. Okay, so then we can move forward into a Murphy sign. So this is going to be checking for inflammation of the gallbladder. So with this, we would start off on our left side. We would ask the patient to take a deep breath in, and we would palpate. Okay, now if we ask them to take a deep breath in, at the same time we are applying that deep palpation, if that elicited a pain response and they stop taking that breath in, that would be a positive Murphy's sign, and it would be indicative of inflammation of the gallbladder. Then next we can go into the obturator test. So this would be another sign to depict appendicitis. So this is where we would take his right leg, bend it towards his abdomen. We would rotate it externally, and we would be checking to see if this would elicit a pain response. Now, with appendicitis, it all kind of, this inflammation resides in this peritoneal area or in the pelvic cavity. So that's why we would take this knee and we would move it closer to his abdomen to see if we would elicit a pain response. So this is a negative finding. So overall, this is a healthy abdomen and there's no abnormal findings here. Thank you.